to introduce Linda Bopp, who is the director of Hunger Solutions New York, which was formerly called the Nutrition Consortium of New York State, and which I also have a fondness for because I founded it back in the late 1980s. Started with money from the Department of Health. Linda has had a diverse array of experience and issues, but I will say, then she will probably talk about this, they are the intermediary funder for many, funded by the Department of Health, many projects around the state of New York that are doing work on SNAP enrollment and all the other federal food programs, and so we're delighted you could join us today, Linda.
Good morning, and it's a pleasure to be with you today. I'd like to thank all of the commissioners of the National Commission on Hunger, particularly the ones that are with us today, for what you do individually and as a collective group to end hunger in the U.S. I'd be remiss, obviously, if I didn't thank Russ Sykes for all the history he has in founding what is now Hunger Solutions New York, formerly the Nutrition Consortium, but also his hand in crafting the legislation that became the Nutrition Outreach and Education Program, which I'll talk about in a bit. So thank you. The work of this commission is critical given the prevalence of food insecurity and very low food security in the nation and in New York State. According to the USDA's most recent data, in 2013, 14.3% of U.S. households experienced food insecurity, and of those, 5.6% experienced very low food security. New York State's rates were close to the national average at 14% and 5.2%, respectively. It's important to note, however, that food security in New York State has increased by 4% over the average of 2001 to 2003, and very low security has increased by 2.1% over that same period of time. Both increases are statistically significant. Nearly 21% of U.S. households with children were food insecure sometime over 2010 to 2011, and 10% of all households with children, one or more of the children were food insecure at some time during the year. And in 1% of households with children, one or more child experienced very low food security. In addition, 3/4 of households with food insecure children had one or more adults in the labor force, either full-time or part-time. Also of concern is that among New York State's older adults in 2012, 3% were facing hunger, which equates to USDA's very low food security measure. These statistics illustrate that people are struggling from cradle to grave. All of these statistics require urgent attention and speak to the necessity and timeliness of this commission. Hunger Solutions New York, formed in 1985 as the Nutrition Consortium of New York State, is a statewide nonprofit organization. Our mission is to alleviate hunger for all New Yorkers. Our goal is to maximize participation in the federal nutrition assistance entitlement programs by all who are eligible. Hunger Solutions manages the statewide nutrition outreach and education program. NOAP is one of the largest SNAP outreach, education, and application assistance programs in the country and is nationally recognized model for such. In 2013, the Food Research and Action Center awarded Hunger Solutions New York with the first Innovation in SNAP Outreach Award for NOAP's exemplary innovative work to connect veterans and military families with SNAP benefits. It's a unique model that combines statewide information, education, and technical assistance for several nutrition assistance programs with community-based services. At the community level, NOAP coordinators provide outreach, education, and application assistance to potentially eligible SNAP households. In addition, they work closely with those households throughout the SNAP application and benefit determination process to eliminate barriers to participation and to secure an appropriate benefit determination. NOAP coordinators also do outreach for the summer food service program and school breakfast program. Currently, NOAP services are provided by 74 NOAP coordinators in 56 counties through 52 community-based organizations. And on the next page, you'll see some of the results. If we take the 3-year average, just to give you a sense of the scope of the program, face-to-face contacts on an annual basis is about 178,000, SNAP pre-screenings, 58,000, and assisting households in enrolling in SNAP 28,563, bringing approximately $70 million into New York State's economy through SNAP benefits. It's through NOAP coordinators, as well as our statewide work, our efforts with partner organizations, and efforts with neighboring states, that we learn about and learn from communities and clients' experience with food insecurity. You have a few examples from our NOAP experiences in your material, but for today's purposes, I will limit it to just one. A family of 5 relocated to Saratoga County for a work opportunity. Unfortunately, soon after arriving, the company closed and the father lost that job. He got a part-time job right away at Lowe's. They live in a rural setting, so while her husband was at work, his wife had no access to a car. They were struggling to pay for rent and food. The family applied for SNAP with the help of a NOAP coordinator and received benefits. This allowed them to afford the nutritious food they needed and continue to pay their rent. The father got a second part-time job, and now they receive a smaller benefit. He continues to look for full-time employment. For every example that we can give you, there are thousands more behind it. Each unique, each come to these circumstances through a series of events, and each need individualized assistance in navigating the system to obtain SNAP benefits. Among the many lessons we've learned from our direct experience and from others, we've learned that USDA's nutrition assistance programs are successful in boosting nutrition, health, learning, and household stability. We've learned that federal nutrition assistance programs reduce poverty. SNAP kept 381,000 people out of poverty in New York State between 2009 and 2012, including 162,000 children. We've learned that very low security is likely to occur in households facing multiple hardships. We've learned that very low security is more prevalent in households with children with certain characteristics, such as households with children headed by a single woman, women living alone, men living alone, Black non-Hispanic households, and Hispanic households. However, the largest prevalence of very low food security is among households with incomes below 185% of the federal poverty line, meaning inadequate financial resources is the overwhelming cause of very low food security. We've learned that people need access to services and education about those services. We've learned that SNAP's complexity results in multiple local and individual barriers. NOAP coordinators identify and resolve approximately 200 local and individual barriers each year. We've learned that SNAP's countercyclical design worked perfectly during the recession. Participation went up, and now that the economy is slowly recovering, participation's going down. We learned that it's critical to ensure SNAP is available to people as quickly as possible. We've learned that current SNAP allotments do not get people through the month. The inadequacy of benefits puts added strain on the emergency food system. We've learned that the current method of decreasing benefits for every additional dollar earned creates a cliff effect for recipients, perpetuates very low food security, and results in a disincentive to work. From our neighbors in Vermont and Maine, we've learned that penalizing people who are unable to find work can have devastating effects and increases very low food security. Referred to as able-bodied adults without dependents, ABODs are extremely poor, and even while on SNAP, the average income is just 19% of the poverty line for an individual. Evidence shows that the circumstances and conditions that lead to food insecurity and very low food security are many, varied, and unpredictable. Evidence also shows that the negative impacts are broad, deep, and have lifelong effects. It's from all these learnings that we put forward the following recommendations. Relative to SNAP, maintain the core principles and integrity of SNAP. Protect the entitlement status of SNAP. Provide sufficient funding so that states can effectively administer and meet the needs of hungry people. Protect and continue to invest in SNAP outreach and education, including non-English outreach. Allow outreach funds from all different benefit programs to be combined to ensure that very low food secure households learn about all the different benefits that are available to them. Also, conduct outreach and education through the systems with which people experiencing very low food insecurity interact: healthcare system, education system, and similar. Streamline and simplify SNAP. Ensure recertification periods are no less than 6 months, and eliminate reporting requirements between recert periods. For households with little or no changes, allow recertification without an interview. Align program eligibility requirements of all means-tested programs to allow for simplified and unified applications. Increase access to SNAP by eligible individuals. We would recommend creating child-only cases for non-parental caregivers and eliminating the ABOD rules, which cause the most food-insecure adults to lose SNAP benefits. Expand the number of people who are eligible by eliminating the 5-year bar for lawfully present non-citizens and exclude adoption, kinship, foster care subsidies from being counted as income. Try to rush. Maintain and increase the adequacy of benefits by improve the monthly SNAP allotment by using the low-cost food plan. Maintain state flexibility to provide nominal LIHEAP benefit to the neediest low-income houses. Remove the cost-neutral rule for states implementing a standard medical deduction. Introduce incentive programs at farmers markets, grocery stores, and other food vendors to increase buying power for fruits and vegetables, including fresh, frozen, and canned produce, as well as lightly processed food. And last, provide transitional SNAP benefits, similar to those provided in TANF. As Kate mentioned, the work that Commissioner Chilton has done in terms of the cliff and preventing that cliff from occurring, we fully support that idea. Among child nutrition programs, while not direct economic support programs, the indirect benefit of these programs to the financial resources of very low secure households make them critical. For free and reduced price, in New York State, over 1.5 million students qualified for free and reduced price school meals, and 3 out of every 4 public school teachers say that students regularly come to school hungry. Through child nutrition reauthorization, it offers a strategic and significant opportunity to strengthen child nutrition programs and ensure that they are working effectively. During reauthorization, we believe that steps should be taken to maintain the core principles and integrity of all child nutrition programs, improve the nutritional quality of meals served, and then within in-school programs, again, maintain the core integrity, increase the school breakfast and national school lunch program reimbursement rates for meals served, increase access to child nutrition programs by low-income children by encouraging the use of the community eligibility provision to provide universal free meals, expand and increase participation in the school breakfast program, eliminate the reduced price copayment and allow free meals to students up to 185% of poverty, provide more adequate school breakfast funding to high poverty schools, and last, within in-school programs, streamline and simplify child nutrition program administration. For out-of-school programs, I won't go into the specifics, but again, streamline, especially CACFP, streamline the administration of that and increase access to the summer food service program by open site eligibility, improving the open site eligibility threshold from areas where 50% of students qualify to areas where 40%. And that sums up. And while some of the older adult nutrition programs do not fall within USDA, we would certainly ask that the commission be mindful that those programs need to be maintained, especially with obviously our aging population. So we would ask that you recommend that those programs be maintained, funding and integrity. And I thank you very much.
Thank you, Linda. Appreciate your comments. I know you probably have questions. I have a couple. Can I start off?
Carry on, Russ.
Okay.
Carry on.
Both you and Kate, interestingly, and I just want to pose somewhat of a provocative question because we've heard the opposite from some people. I'm very cognizant of how responsive SNAP is to economic downturns in communities and so forth, but we have heard from other people that the ability to test innovative programming in SNAP is very difficult because USDA and FNS are slow on the trigger to grant waiver and demonstration authority quite often. If the financial responsiveness issue were to be removed, in other words, unlike TANF, if you were to create a SNAP block grant at a level right now where benefits are very high, and you built in an inflation adjuster for those kind of economic downturns, what would be the other reasons that you would still not entertain the notion of state flexibility under that kind of a situation?
I think the economy is just so volatile, and you can never predict. Nobody could have predicted what happened in the last recession, and had SNAP been block granted, I don't think it would have been at all possible for the program to absorb the number of people it needed to absorb. That's very big.
A fair answer to a long question. Just you also, I think you're probably aware this is more of a New York issue, but in New York we're state supervised county administered system, 58 districts. The state is now embarking on a pilot project to particularly deal with the issue of SNAP recertification. It's in several small counties right now, but the notion is we lose people at recertification, sometimes because they found employment, they're no longer eligible. They don't check in with a worker quite often, but we're trying to the pilot is trying to mechanize that process and take the onus off the local staff worker, and I wonder what you think about that general idea.
We would support anything that makes recertification simplified. We would agree that people fall off the program unnecessarily through the recertification process. NOAP coordinators do assist in the recertification process across the state, but if there was a way to centralize that or have that done at the state level, anything that would simplify that would be a good thing.
And then my last question, and I'll turn it over to Mary Ann and Robert if they have, but recently USDA authorized, New York unfortunately did not get one, but authorized 10 pilot employment and training programs with a broad spectrum of ideas aimed to try to help able-bodied, SNAP recipients find employment and maintain employment. And even though we didn't get one of those grants, I think it would be useful to talk in New York. We have one of the most ambitious and strong E&T programs already, one of the largest users of funds. But are you generally supportive of the concept of trying to help more people get to work through SNAP, if they're able to?
I think the concept is a positive one. It's the execution that usually is lacking. The idea of encouraging work is a positive thing, but when it's used as a punitive approach, I don't think that's effective. I would rather, we would rather see kind of a voluntary employment and training approach, especially continuing in the recovery of the recession is just so slow for the lowest income people, especially ABODs, that we would rather see the waiver maintained, the rules eliminated. I mean, when you talk about trying to reach the very low food security, that group of people is smack dab in the middle of that group. And so to reach that group, very low food security, provide benefits to those people that are in that group.
Well, hopefully we'll learn something from these pilots. They're going to be rigorously evaluated by MDRC and Mathematica, and they're a combination of mandatory and voluntary and creative ideas. So glad to hear you're at least open to, making things like that work.
I have a couple questions.
Okay, go ahead,
You can
Robert,
go
since
first.
I had chances before, but I do have questions.
Thanks, Linda, for being here. How would you react to USDA changing its policy on the distribution of benefits so that it came twice a month instead of only once a month?
I think that would be positive. It would create a more consistent cash flow within the home. I don't see anything negative about that.
Okay, Thanks. What about a policy that mandated that stores have a minimum, stores that participate in the SNAP program have a minimum shelf space for certain kinds of products, fruits and vegetables, and a minimum shelf space for certain other kinds of products? What if there was USDA used its regulatory authority a little more aggressively on participating stores to make sure that they have sufficient healthy products and not overstocked in products that do damage to the health of children?
My reaction is that anything that puts more healthy food at the hands of people who need it and would purchase it would be a good thing. That's kind of asking the stores to make available to their customers what they may have if they lived in a more accessible location.
And then I have two more. Since you brought up the question of ABODs, given the reduction in unemployment, where are we now in New York on the ABOD waiver issue? What's the current status of the rule?
My understanding is that it expires in September.
It is scheduled to expire in September.
That is my understanding.
Statewide?
And statewide.
So the
That's my
state will no
understanding.
longer have the ability to offer the counties the option of taking the waiver
with
because
very
unemployment
few-
will be so low.
I think with very few exceptions. I think there are still a couple of counties.
Okay.
But that's my understanding, September of 15.
Okay. And the last question is, it comes up a little bit, administrative funding for, what is the source of your funding and what is the amount?
We did not calculate that. Which funding? I'm sorry.
Funding that you receive to run your program.
Oh, I'm sorry. Okay. We are both state and federally funded. The state amount is $3.8 million, and most of that is matched, so the entire contract is $5.8 million. Some of the funds from the state are held back, so to speak, and not matched with federal SNAP outreach funds because those funds are used for child nutrition outreach and education.
So every state gets an allocation of money that it can match with state dollars to have outreach programs like yours. And in New York State, it amounts to about total $7 million a year. Mm-hmm. Thank you.
I was very impressed with the outreach endeavors you talked about with NOEP. I'm wondering if you can talk a little bit more about some of the barriers to outreach and to SNAP participation for veterans and active duty military, if they're families. And also, are you working with any of the tribal groups in the northern part of the state, Iroquois, Mohawk, et cetera, and what might be some barriers there?
Barriers in general, they fall into many different categories. There's everything from documentation barriers to budget barriers where the budget is miscalculated. Excessive documentation is often asked for. So there's a whole list of categories of barriers that occur sometimes sporadically, but certainly, again, we talked about 200 each year across the state. Veterans in particular the pride issue comes into effect. They are very hesitant to ask for help. They are, one of the stories in here speaks to a veteran who was literally living in a cabin in the woods, a two-room cabin, and just thought that was how he needed to subsist, and was hesitant, but finally did come around based on conversations with a NOAA coordinator, and applied for benefits, got SNAP benefits, and that encouraged him to keep going. So he then got SSI, and then went to the Veterans Administration for even more assistance. So it's an overcoming both fear and pride and all of the stigma that goes with that. It takes time and patience.
Thank you.
Thanks.
Do you have a project in Jefferson County? Do you do any work with Fort Drum?
We do. We do a good amount of work with Fort Drum, a very, very effective NOAA subcontractor up there for years.
Thank you.
Okay.
Thank you so much.
Thank you very much.